There we go. Awesome. Okay.
It looks like it's recording, Megan.
Yes, it does. That's
Okay.
great. Okay, so welcome everybody to the November meeting for the United Spinal Association's Northeast Ohio chapter. We are very excited to be here. Just a few announcements before we get started with our speaker. Just in are these nice little ready-to-roll kits from United Spinal National. If you have not seen or heard yet, United Spinal National is just released a emergency preparedness program. They call it Ready to Roll, and because they're just launching this, they sent every chapter 40 of these Ready to Roll kits. I just received half of them in the mail today. I think I'm getting the other half tomorrow. But ready to roll means that you're reflecting, educating, assembling, developing, and then that you are ready. They give you all of these information sheets, a little checklist to what to include in emergency kit, and then some paper templates for developing an emergency plan. They just had a webinar last week. It was a fantastic presentation, but just there's all kinds of things in here: pill cases, a disposable razor, some straws, first aid kit, those warming space blankets, a foil rescue blanket. I call them space blankets. If anybody watched Better Call Saul, space blankets. A flashlight that is also, like, you push this end here and you have some screwdriver heads that fit into the top. That's pretty cool. There's a Swiss Army knife in here, some plastic bags, Ziploc bags, trash bags. What are these? Oh, and a poncho, whistle. I already said the Swiss Army knife, some zip ties, wet wipes. It's a nice little starter kit. So I'm going to be creating a Google form for us to send out to all of our members, all of you guys. And we have 40 of them. So the first 40 that requests one, we will figure out how we are distributing this and then include that in the Google form. But I mean, it's a nice little over-the-shoulder bag. Pretty nice. Pretty excited about it. All of the grocery gift cards have been requested. Ariel got all of them out into the mail today. If you are one of the couple of people that requested an Instacart gift card, I will be doing those as soon as this meeting's done. So you'll have that tonight as well. New Mobility is having a webinar about higher education with a physical disability. They researched and produced, they researched and interviewed more than 80 wheelchair using students with a disability, and they have collected a list of wheelchair friendly colleges. So that'll be a great webinar to go to or attend if you are interested in attending higher education. I will put the link to register in the chat box for you to copy and paste for later, as well as the article that they posted in New Mobility. Also, Hollister is looking for intermittent catheter users to join a continence care research panel. The panel will assist Hollister as they develop and refine new and existing products to meet the healthcare needs.
I've never seen the
The panel, if you are a panel participant, you would have the opportunity to evaluate products, share your thoughts and your opinions, and you would be compensated for your time to complete each research activity. So I will put the email address also in the chat for how to learn more or register and get the link to apply to join. If you are in need of any KN95 masks, the chapter has, I think, a good amount left. So if you need a couple, send us an email, unitedspinalneo@gmail.com. I will put that in the chat as well. Just let us know that you need a couple and we will mail out to you. I meant to look at that form. So the board is looking to switch up some of the chapter meetings. Maybe if that's what's wanted, you know, we're moving into, or we are in, just everything's virtual, everything's over the internet. So if we can switch up these meetings to create more interest in attending, however we can serve you. So we do have a Google form I will send out and put the link in the chat with this replay, just asking for your opinions. What do you want to see? What topics do you want to hear about? You know, we're here to serve you guys. So all of the feedback in the world is appreciated. If you ever have a question, if you ever need a resource or connected with somebody, send us an email to the email that I'll put in the chat. If we don't know the answer, we will certainly find the answer. So, I mean, with that, if you're interested in helping us plan some of these meetings, any other virtual social event, just let us know. We would love to have you help out, you know, get some fresh ideas, just freshen things up a little bit. So yeah, I will put all of those things in the chat while Christine is talking. But tonight we have Christine from the PAM Specialty Hospital of Denver that's going to talk to us about pressure injuries, how to prevent them, all of that good stuff. So thank you for joining us tonight, Christine.
You bet. I'm so pleased to be here. It's an honor. I'm just going to move the chat bar down. Can you guys see the slide deck that I have open?
Yes.
You can all see that? Okay. So as Megan said, my name is Christine Lundgren. I am a nurse by background. I haven't been a bedside nurse in many years. I've been more working in the business development sector. I've been in hospital care, home care, hospice care, and now with PAM Specialty Hospital of Denver, it's a long-term acute care hospital. So what that is basically when you leave the acute care hospital, like you go to a major medical center and you have treatment, sometimes we have folks that still need continuing treatment, and so they'll come to us. And go ahead and ask questions as we go. If it gets too noisy, I can mute everybody so you can hear. Just let me know. But if you have a question, please ask. So PAM Specialty Hospital of Denver is part of the post-acute medical family. So that's what PAM stands for, if you were wondering. So we are one of about 45 or so LTACs, or long-term acute care hospitals, and inpatient rehab facilities. So nationwide, we have about getting close to 50 facilities. So we've got a pretty broad footprint. But the Denver hospital is unique. Even within post-acute medical, we have a signature wound care program that is unlike anything else in the nation. So we have folks that come to us from all over the US to our Wound Healing Institute of Denver. So I think I might, Megan, if it's okay, I might mute the line.
Yes, please.
There's a little bit of, let's see. little bit of background. Let's see. Wow, we have 22 participants. That's wonderful. Okay. So I have you guys muted now. Just send me a chat if you want me to unmute if you have a question. So PAM Specialty Hospital of Denver, as I mentioned, is part of post-acute medical. So that our parent company is based in Enola, Pennsylvania. And we provide that post-acute care. So it's services that are needed once you leave the acute care hospital. So I mentioned we have LTACs, or long-term acute care hospitals, and also inpatient rehab hospitals. We are committed to providing high-quality patient care and outstanding customer service. So that, coupled with loyalty and dedication of highly trained staff, is our mission to be the most trusted source for post-acute services in every community it serves. So that's just a little bit about post-acute medical. Okay. Sorry, my slide doesn't want to go forward here. Okay. Okay. All right. So the reason we're here tonight and to speak with you all is about pressure injury prevention. So we don't want you to get in that situation where you need a specialty inpatient wound care program. And sometimes that's necessary. So what we want to focus on is pressure injury prevention. So with someone with a spinal cord injury, you are at high risk of getting a pressure injury. That's just a fact. And so a pressure injury is a wound that's caused from constant pressure to the skin. There go the name. So some people may have referred to them as decubitus ulcers or bed sores, that type of thing. When you have a spinal cord injury, as you know, you might not feel parts of your body very well. And because of this, you don't feel full discomfort from constant pressure on your skin. When you don't have full feeling or sensation, you need to get in the habit of shifting your weight, and that's all part of the prevention strategy. So as I mentioned, pressure injuries are called pressure sores, bed sores, etc. So the importance of avoiding pressure injuries, these pressure injuries can develop in just a few days, and I would say hours. So pressure injuries do not heal like normal skin. Once you have one, it may take months or years, I have heard from some of our patients, to heal it. So to heal a pressure injury, you must avoid putting weight on it, and you need to clean and care for it every day. So skin that's had a pressure injury is never as strong as it was before. It's always going to be a little bit weaker. That skin structure is maybe just not as strong as it was prior to the pressure injury. So it's best to prevent those pressure injuries from happening in the first place. Okay. So pressure injuries greatly affect how you live your life. And you guys are probably well aware of you maybe had one yourself, or you've known friends, colleagues that have developed a pressure injury. It can really impact your life. I was speaking with a gentleman and he is, speaks, he has a TED Talk and he talks about spinal cord injuries. And he told me that he had a pressure injury. He was in a nursing home for 2 years. And he's a young man in his early 40s. And I was like, boy, I wish I would have known you then. I maybe could have offered some help. So that's just the way that it can impact your life. Sometimes these pressure injuries can't heal on their own and they need surgery. We've got someone admitting here. I'm just going to admit them. These wounds put you at high risk for infection and other complications. And pressure injuries can happen anywhere on your body, from your toe to your ankle to your hip to the back of your head. And pressure injuries are most common over bony prominences, and that makes sense because you have a hard surface underneath skin that can really build up pressure when there's pressure exerted. The high-risk areas include your tailbone, your sitting bones, your hips, your elbows, ankles, and heels. Okay. So pressure injury prevention. So how do we prevent this from happening in the first place? And one of the main things is daily skin checks. So daily skin checks are the best way to spot a potential pressure injury. It's recommended that you do your skin checks first thing in the morning and then again at night before you go to bed. So it's kind of like flossing your teeth, you know. Maybe things we don't like to do, but we get in the habit of doing it, and then that just becomes part of your self-care. So when you do these skin checks, pay special attention to bony areas or areas that are reddened for more than 30 minutes. So if you see something that's red, sometimes if you watch it, that redness will go away, but just keep an eye on it and make note if the redness doesn't go away easily. Some folks have used a long-handled mirror to help you see hard-to-reach areas, or you can ask a caregiver, friend, or family member to help you do these skin checks. The early warning signs of a pressure injury. If you notice a warning sign, you must take action or it will get much worse. So this is something where you see a well-defined red area, and on darker skin, it can look like a blue area. These red areas will become pale when you press on them, which is called blanching. So that can be normal. You'll see that eventually that redness disappear, but in this situation, this is a red area that does not blanch and does not just disappear on its own. So that's an early pressure injury. You need to treat it seriously. Swelling or skin that feels full of fluid. Pressure injuries often develop between your bones and skin. And you may just have an area of your body just doesn't feel right. Sometimes the pressure injury starts under your skin and you can't see it. This is called a deep tissue injury. Also, blisters or broken skin, that can be an early sign of a pressure injury. Well, you may have heard of pressure injuries. They are staged. A non-blanching red spot, so that's something that you push on and it doesn't blanch out, it stays red. That's considered a stage 1 pressure injury. And I would recommend people always ask your provider if you have any of these type of symptoms. And now telemedicine is nice, that sometimes we can get in front of a physician quickly or talk to them on the phone. But with a stage 1 pressure injury, you want to seek attention. Broken skin is a stage 2. And then a deep sore is a stage 3 to 4. So sometimes that can even go to the bone. And that's a lot of patients that we see have these deep sores, the stage 3 and 4. So what do you do if you see a warning sign? If you have a warning sign of a pressure injury, you must act right away. So keep pressure off the area until the skin returns to normal, and just check the area regularly. If your skin is broken or the area does not return to normal in 24 hours, see your doctor right away. So things not to do: don't rub it, don't massage the area, do not apply heat to the area, and when you have an area like this of concern, make sure you're not putting heavy things in your lap, which could cause increased pressure across the hip region, your sitting bones, and that type of thing. So we know now what to look for, and I'm sure you're going to have questions about that too. But the number one thing you need to do once you're checking your skin regularly is keeping your skin healthy. So relieve pressure regularly, and the best way to prevent a pressure injury. So is this preventative measure. So it's important to shift your weight to relieve pressure every 15 minutes. So, and these pressure relief movements should last 1 to 2 minutes. So I know a lot of folks have a timer on their phone, they set it. Maybe you have a chair that, you know, automatically adjusts. But anything you can find to help remind yourself to do these weight shifts is really helpful. So pressure relief maneuvers, you can lean forward or to the side in your chair. There's also a push-up maneuver to lift your backside up off the chair if you have strength and mobility in your upper arms or your upper body. And using the tilt feature on your chair is also very helpful. Okay, so when in bed, use pillows to relieve pressure from bony areas. Avoid hard surfaces. Always use soft padding under the parts of your body with reduced feeling. So when we have patients come to us in the hospital, of course, we use very sophisticated air loss mattresses, because once we treat a wound, we want to make sure that we're not putting pressure on any area of the body. So just so you know, and some folks have pressure air loss mattresses that you might use at home. Not everybody has those. I think you can pad yourself really effectively just using pillows or soft padding. Okay, continuing on with keeping your skin healthy. Keep your skin clean and dry. Wet skin is more delicate and vulnerable to a pressure injury. So if any water or wetness gets on your skin, make sure you dry it and clean it immediately. When you're bathing and showering, use warm, not hot water. The reason is if you have areas of the body that with a lower sensate level, you may not be able to tell if the water is too hot and you could get a burn. You want to wash your skin daily with mild liquid unscented soap. Dry your skin with a soft towel. Pay attention to areas where skin meets, skin folds, your backside, groin, etc. Avoid sweat from staying on your skin for long periods of time. So if you're working out or you're in a situation where you're sweating, it's good to get that sweat off your skin right away and make sure that all your skin folds, even your arms and legs, that is removed and that skin is dried. You want to wear loose clothing and shoes. Bunched up clothing and tight shoes can add pressure to your skin. If you're wearing a leg bag, you want to wear it on a different leg every other day. So just switching it back and forth, just so there's not undue pressure or rubbing on one area of the body. And then reduce friction and rubbing. So you don't want to have someone or be pulling your body across surfaces. That can cause shearing of the skin. And I've seen that happen where folks that maybe don't know how to move someone inadvertently cause shearing of the skin, such as sliding sheets, etc., and causing undue friction. Okay. Moving on, and this is just in life, but it's for your skin, which is the largest organ in your body. Eat a well-balanced diet and drink plenty of fluids. So can't underestimate drinking water, eating a balanced diet. Your skin needs vitamins and protein to stay healthy. So if there ever is a breakdown situation, you need even more protein and good healthy food to help you heal. To keep skin healthy, eat lots of protein every day. And of course, everybody has their own dietary regimen that they follow, but our dietitians at our hospital would really encourage protein-rich foods like meat, fish, eggs, nuts, beans, or tofu. You want to drink plenty of water, as I mentioned, and other fluids to keep you hydrated. And keep alcohol and caffeine intake low, as they can dehydrate you. So those things can kind of work against keeping your skin healthy. Okay. Any questions? I was going to go ahead and unmute you guys. Oops. Sorry. Okay. Okay, sounds like you got, if you have questions, you can go ahead and ask. Is this a good time? Okay. Just if you do think of things, you can just shout out or, send me a chat here and we'll get those questions answered for you. So now that we've kind of talked about the prevention piece of it, I'll talk a little bit about what treatment options there are. So we'll talk about a couple of treatment options that are available in a lot of places, probably in your local wound care clinics, your hospitals, but we have a specific wound healing program here in Denver, and I'll talk a little bit about why it makes it so different. So our multidisciplinary approach, and that just means that it's a whole team of people It's our wound care nurses, our surgeons, like I mentioned, dietitians, case managers, physical therapy, occupational therapy, and then all the different physician groups that we work with. Of course, our wound doctors, we have nephrologists for kidney, we have hospitalists, pulmonologists, so all those disciplines united, and so that's our multidisciplinary approach. So that's one of the key drivers in our success. So due to our team approach and a couple of other things, we have a 90% success rate in getting wounds healed. So just thinking about that, we're really proud of that. That took a lot of work to get to that point. And it's very unusual to see that high of a success rate. So our progressive wound care team conducts a thorough review of your clinical data and images of pressure injuries and wounds prior to admission. So that's just part of that kind of comprehensive multidisciplinary team. Everybody kind of gets involved and comes up with a care plan. And then on admission, this individualized treatment plan or care plan is created and then implemented. And these plans are designed for those individuals with impaired tissue integrity and non-healing wounds. And like I said, most of the folks that we see have those stage 3 and 4 non-healing wounds. Okay, so this is just a little bit about who we are, who is on this team that I spoke of for the Wound Healing Institute of Denver. So Dr. Pradeep Rai, he's the director of our wound care program. He has 20 years of diverse experience in general surgery, including wound and burn care. And Dr. Craig Reynolds is director of plastic surgery, and he has 43 years of experience in plastic and reconstructive surgery right here in Colorado in the Front Range, Denver area. So they're both very well known, highly esteemed. And this is that wound care team that I spoke of. So our wound care team, we see patients 7 days a week. It's not that someone comes in and we're just seeing they're having wound rounds just a few days a week. It's every day. And all those folks that you see there that I kind of spoke of, the surgeons, the wound care nurses, our rehab services, dietitians, case management, and then our group of doctors. We have the internal medicine, pulmonologists, infectious disease, nephrologists, etc. So that's just an idea of what comprises our team. So we specialize in the treatment of stage 3 or 4 pressure injuries that I spoke of, non-healing wounds, refractory, which just means resistant to traditional treatment modalities, complicated post-surgical wounds, infected and or draining wounds, traumatic wounds or amputations, grafts, fistula management, and most definitely post-spinal cord injuries and complications, very common that we treat. So I talked about that 90% success rate. So it really is that team performing. We have a procedure that's done at the bedside called the complex wound closure. So once someone has this closure, they go through a very regimented program of 6 to 8 weeks aftercare. So those two things combined is what gives us that success rate. And this complex wound closure program is not available in any other hospital. Yeah. So it's an innovative surgical technique. It was designed really to develop difficult to heal wounds. What's unusual about it is it's done at the bedside. So we have someone come into our hospital, they're admitted, evaluated, and they'll have surgery sometimes that next day on that wound and then begin that aftercare program. So having surgery at the bedside avoids a lot of additional metabolic stress on a person, especially if the other option would be a traditional flap surgery. And I'll talk a little bit more about that. A complex wound closure is performed at the bedside under local anesthetic. So that's another win. We're not putting someone under general anesthetic. We're not transporting to the OR. Anesthesia, multiple transitions pose a greater risk for additional skin breakdown. And with a traditional flap surgery, a colostomy placement may also be needed. And sometimes that's needed. But if we can avoid that by doing a wound closure versus a flap, then that's just a win overall. Okay, so a little bit about a flap procedure. You may have heard of it, called a muscle flap. It is a plastic and reconstructive surgical technique in which a tissue is removed from a donor site and moved to a recipient site with an intact blood supply. So if you picture taking basically this tissue and sometimes rotating it to fit into the area that has the wound with the blood supply intact. And what that does is that keeps that blood flow, hopefully, in theory, to that new recipient site, which is where that stage 3 or 4 wound was. So it's used to fill a defect, such as a wound. So it's actually removing tissue and placing it on another site. So like as with a graft, that's when remaining tissue is just moved to another site and it doesn't have those blood vessels attached. So the flap procedure is commonly done to address stage 3 and 4 wounds in those areas where maybe the tissue is not able to support a graft. So that's when we look at possibly doing that complex wound closure. So, and I don't want to, if anybody's had a flap procedure or you've had one that's failed, it's just that this is another option for you. So with the complex wound closure, we're avoiding all that other metabolic and psychological stress associated with the flap procedure. And with the flap procedure, what happens is another wound is created to remove that flesh with the blood supply attached and attach it to that wound site. So it's very complicated in the fact of the recovery of it. It requires phenomenal nutrition and all the things that you can imagine to support that. So it just has a higher metabolic requirement than a wound closure. So you're probably wondering, well, what is a complex wound closure? So our surgeon performs a direct closure of the wound in your room. As I mentioned, then you begin the progressive rehab aftercare program of rest, stretching, and sitting. So the direct closure is just what it sounds like. The wound edges are brought together where it's possible. Now, sometimes the tissue isn't strong enough, or maybe there isn't enough tissue to pull those wound edges together. But a lot of times that's exactly what we do. And then a drain is inserted and we maintain that drain, I think, for about the first 3 weeks. So during that aftercare period, so the wound is closed, it's probably been debrided, samples have been taken, cultures, if you will. The wound edges are pulled together and there's deep sutures, if you will, that pull those wound edges together. And then that drain is inserted. So we're keeping anything that's collecting in there pulled out of the body to allow that all to start to heal from the inside out. So healing is what we're all about. We want to improve your wound. We want to make it look and feel better, but we're really about healing it. So this program is unique in that respect. It's a curative approach taken to wound healing rather than conventional. You'll hear this wound management. Well, if I had a wound, I don't want to just manage it. I want to heal it, right? And so we'll talk a little bit about that. So the complex wound closure that I was just describing, it's used to address wounds from pressure injuries, which are often large and are complicated. So basically the term complex wound closure is the complex parts really referring to the wound. The procedure itself is very simple. So this wound closure has been successful with head and neck wounds, abdominal wounds, wounds of the genitalia or extremities, or wounds infected with osteomyelitis, which is infection in the bone. The complex wound closure program has been notably successful in healing wounds refractory or resistant to traditional therapies, such as hyperbaric oxygen therapy, or HBO, as it's called commonly, some high-grade topical dressings. We don't use anything very complicated on our wounds, the vacuum-assisted closure, and traditional flap surgery. So we have had patients who have a wound closure and they may need a wound vac for a portion of that. And I've seen that with an abdominal wound where it just needed that extra suction or pressure to bring those wound edges together. But that's not typical. I would say we rarely do that. And we don't have hyperbaric oxygen therapy in our hospital, so we don't use that as well. So it's really this complex wound closure combined with the aftercare program. That's what gives us that 90% success rate. And so here's kind of a side-by-side comparison. So you have your complex wound closure performed at the bedside under local. Maintain your normal oral or IV pain medicine regimen. Normally, there's not much pain associated with it. There are lesser metabolic demands on you. There's less stress overall due to the avoidance of general anesthesia, and you don't have to go to the acute care hospital to have surgery. So like I said, we do it right there at the bedside. So the traditional flap surgery, that's where you'd have to go to an acute care hospital setting. General anesthesia is used, may require higher levels of pain management, greater metabolic demands on the body for sure. Healing after a flap, you got to have just stellar nutrition. And the physical, mental, and emotional impacts of flap surgery can be tremendous. And as I mentioned, sometimes a colostomy placement may be needed. So our wound care program is really focused on you. So as I mentioned, the individualized care planning is done prior to admission. We have dedicated case management. They begin discharge planning on day 1 and continue throughout your stay. Our overall goal is to send everybody home. There have been occasions where we've sent folks to a lower level of care, which would be like a skilled nursing facility, for a number of weeks to continue healing before they're ready to go home, or before there's care providers in place in the home. Your comfort with our program and protocols is assured prior to admission, along with answering any questions, concerns from your family and friends. So our focus is moving you from hopelessness to hope, to saying, you know what, there's an answer, there's an option that can help you get back to your life. So we address all internal and external factors for each person. So spinal cord injury is definitely a factor. Nutritional deficiencies, we have to correct those. If there's a history of radiation treatment, what that can do to the skin is make it just won't heal as well. So sometimes that's a factor we need to consider. Metabolic conditions, comorbidities, other disease process you have going on in your life. For example, diabetes, that makes wounds more difficult to heal. And also excess body weight and obesity makes it more difficult. The external factors, active smoking, we actually absolutely have to have folks smoke-free when they come to us. And then the marijuana or illicit drug use, marijuana is legal in Colorado. It's not so much, we find that folks that use marijuana, they're just not as compliant. And so we really try to keep that out of the picture. And some folks have been using it for a long time, so we have to kind of, work with them if perhaps they're taking some type of marijuana. But overall, it just makes people sleepy. They don't want to do their therapy, and it just becomes kind of an obstacle. So we want to remove those obstacles. Also, some external factors are non-compliance. That happens a lot. We get folks that just don't want to do the therapies. They don't want to do the program. So they're non-compliant with what we've suggested. Poor hygiene in the home can be a risk factor. Unstable family structures. It just makes life harder when you don't have those around you to help support you. If that's friends or a family member, just having somebody in your corner, that's going to make your recovery go a whole lot smoother. For some of us that have residences in rural locations, that can be a factor we have to think about. maybe having less access to medical services in those areas. Okay. Another thing, and I sent this document to Megan, we have a pressure injury prevention program. We call it PIP. So it's unique to our wound care program, but it's a very detailed pressure injury prevention program. That's one of the things that we monitor when folks come to us. We sure don't want them to develop another wound on our watch. And so we do everything in our power to make sure that they're being compliant with the pressure injury prevention program when they're with us, and then also going home. Wound healing education, smoking cessation, this is all part of what we go over, and we stress these techniques, the proper technique for pressure relief mechanisms, like I mentioned, the, kind of the push-up device, proper timing of pressure relief and chair tilts. For a lot of folks that come to us, they maybe need their wheelchair adjusted, repaired. Sometimes they need a new chair, etc. And so that's all part of it too, is that evaluation. So we want illicit drug abstinence, the proper hygiene, and proper nutrition. So the further wound prevention, so aftercare teaching plan is implemented. We want to assure that continued wound healing success. So if we have someone that comes to us, they leave with a healed wound, it's still not completely healed or scarred underneath for about I think up to 18 months. So that area, it's healed, but it's not scarred down like all the way through. So everything that we teach you and everything that we've done to relieve or to prevent any skin break, to further skin breakdown, and also to promote healing, that's what's promoted to assure your continued success. And this is that PIP guide, the pressure injury prevention, but it just shows, it goes quite in depth. And I think Megan has it, so she can send that out to all of you. It's just a really good document. And then another kind of specialty about our hospital is our We Care program. So when someone comes to us, they're assigned a partner that's a part of our leadership team. So it'll be someone that maybe from our hospital administration, such as our CEO. And this partner will visit you twice a week and ask for any feedback regarding your stay. You'll also be assigned, of course, a case manager on admission. This person's very important. They'll visit you weekly, assist with your plan of care, talk to your family, to your doctors, etc. Ensure a safe transition home or to a lower level of care for continued rehab on discharge. Our goal is to address any issues or concerns you might have during your stay. So we also do a post-discharge survey that is sent out to everyone that comes to us for care, and that's pretty standard. So any questions before I go further? You guys doing okay? Okay. All right, so I just wanted to give you an idea of a patient that we have had. This gentleman, he's a complex wound closure success story. So he's admitted with bilateral ischial stage 4 pressure injuries, and that's his hips. He was a 68-year-old male with a past medical history of a T8, paraplegia from a work accident. He had been treating his wounds in an outpatient wound clinic for many years, and he was admitted to us in March of 19. He had been in an acute care facility, and he came to us, and he had on the right-hand side, these are the things that he had that were not working for him. They may be working against him. So he had a diabetes, a severe protein malnutrition, traumatic brain injury. He had an anoxic brain injury in 1985, major depressive disorder, suicidal ideation and paranoia, hypertension, chronic obstructive pulmonary disease, COPD, neurogenic bowel and bladder, and short-term memory loss. So just looking at that, it's like, my goodness, this is just a lot to deal with. And certainly we worked with him. We had a lot of psych consults working with him daily. But he ended up being discharged home in October of that same year. So as you can see, that's longer than the 6 to 8 weeks that I spoke about. But this gentleman was really quite complicated. And so the minimal amount of time to complete the program is 6 to 8 weeks, but we have some folks that it's, you know, could be 5, 6 months, etc., just depending on the complexity or the severity. And then this is another one I'll share with you. This gentleman had 13, and that's 1-3, stage 3 and 4 pressure injuries. He was a young 43-year-old man, past medical history of T10 paraplegia from a work accident. And he was admitted to us in March of 19 with these 13 wounds. He also had multiple comorbidities. In addition to needing to extract, all his teeth were infected. So they had to be extracted. He had to get dentures. So all that had to be done basically when he came to us. And he had no support systems in place, no family, no friends. And so we knew we were really challenged with this guy. And he was not a Paralympian, but he was an athlete. And he was very muscular and strong, but he just didn't do those skin checks. I think when a lot of his athletic activities and things, he had pressure from his chair. So that was all just kind of in the background that we were taking into consideration a history of deep vein thrombosis, chronic pain syndrome, osteomyelitis, infection in the bone, esophageal reflux, mental health issues. And he had a past surgical history of bilateral below the knee amputations, and reversal of a urostomy that was just poorly placed. So he kind of came to us with all these needs, and we were able to discharge him in August of that year with all of his wounds healed. Now, he did go to a lower level of care. It was a skilled nursing facility, and he was there for a number of months before he was able to be discharged. So just kind of a little bit of just to give you an idea of some of the complexity that we deal with. So, and then I just wanted to mention, this is our flyer. Megan may have sent this to you as well, but basically what we're offering is to those that have been told they have to live with their wound. We're saying, no, we offer hope. We have a 90% success rate in wound healing. So that's kind of what our takeaway is. And you'll see this, we are a national supporter of United Spinal. This particular picture right here will be in a full page ad in December New Mobility. So we're very much invested in supporting United Spinal, and that's just part of what we focus on. And the main thing we focus on is talked about the individualized care planning that's done prior to admission, the dedicated case management and discharge planning, comfort with our program and protocols is assured prior to admission, making sure that we've answered all questions, and our focus is moving you from hopelessness to... Okay. All right, that is the end of my presentation. Let's see. Okay, I'm just looking at chat here. It looks like Megan's posted some things. Kevin asks, are there exercises or activities that you can perform during the 8 weeks of recovery after flap surgery? And certainly we do have folks that come to us for a post-flap care. So they've had a flap surgery, and our plastic surgeon, he does flaps as well. So it's the full boat of all the exercises that would go along with that regimented aftercare program. So in our facility, it started out with bed rest for 3 weeks, then we do stretching, and then eventually sitting to the point where you're sitting 2 hours twice a day. And then that's really where you're able to be discharged once the wound's healed and you're able to sit. So the specific exercises, that would be kind of up to our physical therapist to prescribe. And so that's really part of that aftercare. But I can get some initial or some additional clarity on that question. Let me make a note. They can maybe give me a snapshot of some exercises.
I don't know. I thought.
And Richard asks, where's the nearest facility? So our facility is in Denver, Colorado. So we're a destination hospital for wound care. And we have folks that come to us from all over the US. So we do have other post-acute medical facilities, but none of them program. So we're really it, you know, for that Wound Healing Institute. That's at our Denver hospital.
Yeah. Jill, can you mute yourself, please?
And then Julie asked, do you recommend satin sheets or soft silky underwear to make sliding on the bed easier? You know, that's interesting. I've never had anybody tell me that satin sheets or, you know, there's those bamboo sheets too, they're really soft. I would think anything that's soft next to the skin, silk, satin, would, you know, diminish that shearing potential of movement against the skin. The only thing with satin and silk is that it doesn't tend to wick moisture away from the skin. So I would think that it would be okay. But it would just have to, you just have to see if they would, like if you would sweat, is that going to allow your skin to dry? I would be, I think, more comfortable with like a cotton, like a really beautiful cotton sheet, or there's those bamboo sheets as well. It's made from bamboo and they're super soft and they're also breathable. So that would be my concern about that. And then Tim Mackey is asking, can you tell me how you treat stage 4 pressure sores? Do you ever use a wound vac? So our treatment is the evaluation. We look at the wound pictures and our surgeons go, you know, I think we can do X, Y, or Z. We can bring that person in. We can probably do a closure. We might need to do a debridement first, etc. So it's based on that physician looking at your clinical information and also your pictures. And so that's kind of how we approach it. It's so different for each person. But yes, we would definitely be able to treat your stage 4 pressure sore. It would be, we always try to do the wound closure if possible, but sometimes a flap is needed and our surgeon makes that determination. And then after the flap surgery, there's the post-flap regimented aftercare. That's just like after, very similar to after our wound closure. And we do occasionally use wound vacs, not very often. Like I mentioned, we had a patient, I remember, with a large abdominal wound that had dehisced, or part of it had protruded out, and they had to really, they couldn't get the wound edges pulled together, so they had to use a wound vac to kind of help facilitate that. But in general, no, we don't use them. And Gary, if you don't mind if I read your question. A pressure wound on the backside I'm dealing with, gout infection of the elbow that required surgery. Thus 2 wounds are being treated by a local wound clinic. Any recommendations for treating the elbow? So, you know, I would think your medical, your physician, you know, has probably got a treatment plan for that gout infection. As far what we would be treating, in addition to, like,
Really,
we would not only treat your gout and anything that was going on kidney related with that multidisciplinary team, we would also want to treat that pressure wound and get that healed. So I think that would be twofold. So I don't personally have recommendations for the gout. That would be something that your medical doctor would have to consider, but we are used to having somebody come in for a pressure wound and they need dialysis, or they have diabetes, or they have what we call comorbidities or other disease processes going on. So did that make sense? Did that help? I'm just going to move on here. Tim is asking, is there a product we can request before admission for a surgery to be added to the mattress pads? Most bed mattresses are not SCI friendly. We use the very high end, it's called an Envela bed, that is constantly doing air exchange. And I've never heard that those mattresses are not SCI friendly. So I don't think there would be a product that you'd have to request. Everybody that comes to us gets one of those specialized beds, you bet. That's a big part of the aftercare as well. So Jill asked, can you discuss the treatment for depression that you use in moving patients from hopelessness to hope? Do you use narrative techniques to address depression and loss of meaning? We have a neuropsychologist that rounds on our patients in-house, and I would have to, ask them specifically what treatment regimens they use. It's very difficult. Many of our patients are depressed. And then also there is you're committing to a wound care program that's 6 to 8 weeks. That's a big commitment. However, I think folks tend to, once they see that they're making progress and they're going to end up with a wound that's healed versus going back to the merry-go-round of wound care clinics, that helps address the feelings of hopelessness. But that's, again, something that I would defer to our neuropsychologist. But I can certainly see if there's anything they could speak to. I'll definitely ask that question.
Okay, that'd be great.
Denise asked, are there any future plans to teach the complex wound closure technique to other facilities? So this is the thing. Yes, and the complex wound closure is not complicated. It can be done in any facility. However, what we have is that regimented aftercare program that when you come into our hospital, everybody from your nurse to your doctor to our sanitation staff, everybody's dialed into wound care. So we have developed this program, this aftercare program over 6 to 8 weeks, and that's where the success really comes in. It's the procedure and it's the aftercare program combined. So we are very open with our other sister brother facilities across the US, and many of them have wound programs, and so they're all interested in what we're doing. So we're doing a lot of communication internally as well. Our medical director, who is the medical director for all of post-acute medical, so he's interested in seeing how can we replicate this program at other facilities. But at this point, it's just in the Denver facility. And like I said, we do have folks that come to us. We have a gentleman that's inpatient right now that's from Maine, and that's a long way to go. And we're just pretty positive that he's going to get home before Christmas. So fingers crossed there. But just to give you an idea that I think folks that have just been round and round the wound care continuum with no result will sacrifice and go, okay, I've got to commit to that 6 to 8 weeks. Okay. These are great questions. Thoughts on pressure alternating Aquila wheelchair cushions? That would be a question for my director.
Hey. Down.
Lori, is that your dog?
Yeah.
So I am going to ask about that Aquila cushion. And we have Floyd that's just entering the meeting too here. So he's kind of on the tail end, but I will ask those questions and I'll communicate. I'll kind of gather all this and I will send that to Megan.
Sorry to interrupt there. This is Nigel from Worcester. I have some questions on perhaps a stage 1 or stage 2 pressure suggestions.
Yeah.
I've used, perhaps if I detect a bit of bleeding, perhaps an iodine, a bit of petrolatum gauze rather, and perhaps just when it's just a bit dry. I've used products like Aquaphor, Eucerin Original, and Manuka honey of a high grade.
And that's on skin, pardon me, Nigel, so that's on skin that's intact?
Yes, it is, yes.
Yeah, I have heard, I've heard Meta honey. That's used in wound care quite commonly. And I think that's pretty good. And the Aquaphor, that's a very good, I think that's very good as well. Some of you may have a barrier cream that you use. I think Hollister makes a barrier cream that's good. Let me ask that question too.
The reason why I'm asking, you know, I've maybe stage 2, but I usually see blanching, but you know, because of COVID, I'm working from home, you know, so I'm not as active and things like this, you know, so these are,
Right.
are not heating up. So I just picked up on your presentation earlier on that you don't want it to be moist. And in fact, my very first pressure sore was riding on Six Flags in over in New Jersey and getting wet there. But the thing is, though, with these products, could the petroleum base cause the skin to dry out? You know, that was basically my thought there, because some of these Vaselines, you know, I do wonder whether they would actually cause the skin to break out more.
Yeah. I think the Aquaphor is not a bad idea as long as you're putting that on skin that's intact and that you're making sure that it's very dry underneath. You know, you're not putting that on wet skin to trap wet skin underneath it. I've also, I know for burns and things of that nature where you have intact or non-intact skin or that's healed from a burn, that coconut oil works very well. It's a very good moisturizer for the skin. Again, just making sure that that skin's intact. If you have non-intact skin, like you said, you might have some blisters or you're not sure if it's a stage 2, I would definitely have your medical professional take a look at it for you.
Okay.
Because once they get started, that's the thing. You know, if you can catch it in the beginning and just get it to heal, but I would definitely get their advice on how to do that because they can look at it firsthand.
So I've been using some of the Eucerins and the Aquaphor and even this Manuka honey on a bit of soft padding, soft dressing, 2x2 squares, and basically just holding that there. Being careful what kind of paper tape, because obviously that can break down skin as well, sensitivity. And so I've just been plastering that and just keeping that with that, you know, cream there or ointment. So.
It sounds like you're doing the right things. I certainly just don't want to give you, you know, I don't want to give a medical opinion, you know,
Sure.
without, I think you definitely need to, anything that's not looking like it's going away on its own, I would have your doctor take a look at it. And like you said, I wouldn't use tape. If there's a way that you can put, you know, something over that Aquaphor, you know, and maybe have a clothing item that'll keep it in place versus, you know, tape.
Yeah, only but use a very, very small amount, you know, so I mean, it's,
yeah,
I've watched out for the signs for years, you know, so.
Yeah.
Okay, not bad for 38 years in a wheelchair.
Not bad at all. You guys deserve a
and
round.
also, somebody mentioned about cushions. I use a J Active cushion. I found that much better from a Rojo But I've been looking at the Aquila cushion as well, so that's an option.
Wonderful.
Excellent. Thank you very much for the presentation. And
You're very welcome.
been to Colorado many times. Beautiful place.
Well, we would love to take care of you. Hopefully you won't ever need us, but just so you know, that there is an option out there for you, and we're here for you. I see Lori's asking about barrier cream, and I am going to get the official word on which one we recommend. And then supplements. Yeah, I've heard of Juven. That's back when I was in home care. We had an elderly gentleman with a stage 4, and that was something that was prescribed by his doctor at the time. But I can ask our dietitian too. And this is the other thing, you guys, if you would want to have a consultation with our dietitian, if you would want to ask her some of these questions, I would be glad to set that up for you. I am not a dietitian, so I'm not always up on everything, but that's a huge, I don't want to underestimate that, because that is really a huge piece of it, is the nutrition. And then Julie is mentioning she's had great success with small wounds using Mepilex AG to prevent them from getting out of hand. And you guys know probably what works best on your body. That's another thing that definitely protects that skin from, getting scraped or having that shearing that can go on. So I think that's great advice. But I will get the answers to some of these questions that I apologize I couldn't answer. But like I mentioned, I'm a nurse by background, so probably just don't have the level of detail that you're looking for on the dietitian and the physical therapy. So I'll definitely ask those questions. And also our neuropsych, if there are certain treatment regimens that they use, etc. But it's all part of the overall care. It's really, what do I want to call it? Mind, body, spirit, because if the spirit is hurting, it's going to be hard to have a successful outcome. So we definitely treat mind, body, and spirit for each person. So, but I can, Megan can share my contact information. If you ever have a question or you're just kind of wondering, some of the questions you've asked here tonight have been great. Please feel free to reach out to me anytime.
Awesome. Well, thank you. Since it is the hour, we are going to stop taking questions. We want to honor everybody's time. But Christine,
Absolutely.
Thank you so much.
Thank you.
I will maybe hopefully go by the end of the week, send out the email with this replay, Christine's contact info, as well as that document that she sent me, and then the 2 Google Docs for the emergency kit and just input about our meetings. So that'll come out hopefully by the end of this week or early next week. Thank everybody. Thank you all for joining. This is great. I think this is our biggest meeting yet. So that is awesome. Is a great topic. I know something we all worry about, have issues with, have had to deal with. So it's a huge part of spinal cord injury. But thank you all for coming tonight. Have a great rest of the night. If you need anything from the chapter, reach out to us in the email that I put in the chat earlier. Or you can always just reply back to any of the emails that we send out. So we do not have a meeting in December. It's right by all of the holidays, so December will be taking off, but January 18th, we will resume with the Indigo Personal Exoskeleton. So we had Rewalk earlier this year. This is a different version, and they are coming to Cleveland and Northeast Ohio. So they're going to do a presentation in January. So I take care, everybody. Again, if you need anything from us, reach out to us and we'll do what we can to help you. So have a good night, everybody.
Thanks, everybody. Have a great evening.
Thank you.
You
Thank you,
bet.
Christine.
Thank
Nice
you.
presentation. Very
Thanks,
thorough.
guys.
Thank you, Megan, for putting this on.
Thank you.